Good morning, everyone. It really is an honor for me to address you this morning. My work is mostly in the international arena, and as all of us know, the United States is also a part of international community. So even though it doesn't act it often, but I think it's important to raise those issues with you here today. So I'm going to talk about something that is, in short, called UNGASS. And UNGASS is a UN General Assembly session that happens every year in September, where sort of the heads of state and ministers come together to discuss various issues. And that happens in New York in September. But there are also special sessions. And those special sessions deal with particular issues and problems that have been deemed as important enough to have an UNGASS discussion for. Again, these discussions include heads of state, top-level ministers. So 2 years ago, President Santos, President Perez Molina, and President Calderon made a request at the General Assembly session, made a request to the UN to have a session which would evaluate the impact of international drug policies. So that actually is quite significant. That three heads of state basically said that we have concerns about the international system as it is now, and that we should look at the impact that it's been having. So as a response to that request, a UN General Assembly session that was scheduled to happen in 2019 or 18 actually was moved to 2016. And what really matters is that the spirit of this session is entirely different than it would have been had they not made this request. If you look at UN documents, you know, the statements that you always see is reaffirming our commitment to. They're very sort of blah, blah, blah documents that basically sort of enforce or continue what has happened before. And so we really have an opportunity to sort of make it clear that we would like the spirit of the request made by the three presidents of Latin America honored, and that we actually do want a real evaluation of international system, drug policy system, and a better understanding and clarity of how our lives, whether we live in Poland, whether we live in the United States or Malaysia, how our lives are impacted by the international treaties. So before I talk more about UNGASS 2016, I'm going to spend a few minutes talking about UNGASS 2001. Because I think there are many lessons learned in UNGASS 2001, which was an UNGASS on AIDS. It was not an UNGASS on drugs. It was an UNGASS on AIDS. So just a few reflections. I sat in a meeting, international AIDS meeting in 1998 in Geneva at the AIDS conference, when the news for the West was great. New drugs were being made available for people who had HIV. Those drugs were being made available widely. We were already seeing that really, many people talk about naloxone as Lazarus drugs. ARVs were a Lazarus drugs in those times. People were literally leaving, people who were looking awful and really ready to die were leaving hospitals and basically trying to figure out, oh my God, I'm going to live for the next couple of years. How do I pay my rent? Like this was sort of the level of, wow, those medications really save lives. So this was all happening in Western Europe, in North America. But as you know, if you follow the AIDS stories, none of that was happening in the Global South. So at the AIDS conference in 1998, what we saw were scientists who were super excited about what they had to offer to their mostly white patients in the global north, and thousands, if you've been to the AIDS conference, thousands of advocates, healthcare providers from the South who were listening to these amazing stories and knowing that they're going back to watch people die. They were going back themselves, HIV positive, or healthcare providers that were going back to watch people die awful, painful deaths with very little dignity and a lot of very present and visible misery. So actually at that AIDS conference, I don't know if any of you follow publications of the Lancet, a very prestigious medical journal. At that conference, Richard Horton, who is the editor of Lancet, whose job was to come and basically wrap up the conference with the news of the 4 or 5 days of discussions, came with this lovely stack of papers, looked at them, looked at the audience, and said, I can't do it. I can't do it. You know, he just threw up his papers and talked about the injustice of what he has observed in this conference, the excitement of the North and absolute despair of the Global South. And, you know, and it is, so around that time, just to give you the scale of the problem, roughly 35 million people were living with HIV and AIDS, many of them in very advanced stages of the disease. There were 13 million AIDS orphans, children who watched their parents die awful, awful deaths. And there's nothing we could do for them. Or that was what was being presented to us. The drugs were just too expensive. And somehow, as outrageous as this sounds today, basically that was a given. Yes, medicines cost $15,000. No, Global South cannot afford it. And somehow that seemed sad, but okay. And it really, with this sort of outrage and upset, that people went to the AIDS UNGASS and said that is not acceptable. Pharmaceutical companies cannot run the world. They cannot tell us what is moral and ethical. And that allowing pharma to set a price at $15,000 where all these people were dying is just unacceptable. And, you know, it is about this, it was about this divide of North and South that people really rallied around. And basically, you know, in very diplomatic settings of United Nations, got very angry and very upset and very frustrated. And that included yelling at the President of General Assembly, which I'm pretty sure never got yelled at, at least not at his job. So, so what happened as a result? And, you know, I know that this is now many years later, and it's possible that we're idealizing this process a little. But what happened was that a global fund was created, global fund to fight AIDS, TB, and malaria. And there are two important lessons learned in that. It's not like 2 years before UNGASS, we knew that we want the global fund. We knew that people should be getting care. How is that going to happen? Needed to be worked out. And so the process of working this out was complicated, and it was not painless. And US was extremely supportive of pharmaceutical companies. And US was not on our side in that discussion, as it isn't today on the discussion of drug policy reform. So we're not in an unusual situation. And so Kofi Annan, who was the Secretary General of United Nations, made an incredibly brave decision. He basically worked out a deal where a global fund was created outside of the UN system. Now imagine, you are the head of the UN, of WHO, of UNAIDS, and you basically are agreeing that a multilateral system is going to be set up outside of your own system because you don't think your own system can do the job. And so, you know, for him to do that was incredibly brave. So that's the positive side of it. The less positive side of it is that United States pushed for a system that is outside of the UN. Because as we all know, US doesn't feel a part of the UN very often. and basically said that it will not fund the UN effort. It would have to be an effort outside of the UN. So again, reasons were inspiring and not so inspiring, but the bottom line is that pharma basically was taken on and lost, and that Global Fund was created. Today, 6.6 million people are on antiretrovirals as a result of Global Fund funding. Global Fund spends $4 billion a year in the Global South. So again, you know, I'm sure many of you who work internationally will give us a long list of reasons why Global Fund, you know, is not ideal. And it isn't. But for those 6.56 million people that are receiving antiretrovirals, it's life-saving. So I think they're telling me that I need to wrap up. So let's move on to the UNGASS 2016. My plea to you is that you get as outraged about global international drug policy as we were about AIDS. And I think you have grounds to do it. I think really there are real reasons for that. And I'm sure many of you will have a long list of reasons for that here in the United States. One of the biggest, I think, is the racist implementation of very punitive drug policies. So, but this goes across the globe. If you look at who ends up in prisons in Latin America, it's the poorest, the darkest, and women. Okay, I think that story is very much repeated across the globe. Labor camps. You know, there are 500,000 people in labor camps that are considered treatment. In Laos, in Vietnam, in China, where people work in sun and receive 1 bowl of rice a day. That is their drug treatment. Where people are beaten as drug treatment. There is death penalty. In Malaysia, when I was there 3 years ago, roughly 120 people were awaiting death penalty for drug-related offenses. Again, dark-skinned and poor. If you look at, well, this drugs UNGASS is to be under a very, to me, ironic slogan, protecting our children. You know, I hear this and I think, really? You know, hundreds of children from Latin America on US border that are sleeping on mats, that are basically homeless. Why? Because there is a drug war ravaging Latin America where children are not safe. How are we protecting our children? Women, drug users whose kids get taken away by the state. How are we protecting our children? Black men who are in prisons, whose kids are growing up in cities of the United States. How are we protecting their children? So I really think that we have solid grounds to be really outraged and to articulate this outrage towards the UN. So how would we do that? In the United States, it's your State Department that is going to represent the United States at the meeting. Find ways, be creative, find ways to make sure that from today on, that their tweets, Facebook postings, faxes, letters going to the State Department saying, you know, we want to be included. You're going to be speaking on our behalf at that UN session, and here is what we have to say. Make sure that you encourage the office of the drug czar, who was here yesterday, Botticelli, to be bold in his engagement. Because if not, it is going to be the INL, basically the international DEA, that is going to represent your interests, US interests at that meeting. So find ways to communicate your displeasure with the international treaties, find ways to engage. This conference is giving you 3 such opportunities. There is a session that you, information about which you found in your bags, organizing for UNGASS tomorrow at 12:45. There is a session today at 5:45, if I understand correctly, and also tomorrow morning, and Alan will have details about that. So please take the opportunity to think about how to do it. And know that there's HRC, there's us, there are many others who will help you through it, who will talk to you about this, because again, I think this is an opportunity not to be missed. We changed the world with UNGASS 2001. Let's change it again in 2016. Thank you.